A lot of people think that they can't stop drinking. And they also think that if they do stop drinking, that life is going to be miserable and it's going to be terrible. And a lot of times people come into our program and they stop drinking. And for some people, it really is difficult at first, and sometimes they get depressed. And so sometimes you got to work with that. You got to manage that. But there's a good percentage of the people that when they stop drinking, it's a refreshing thing. They talk about the additional time that they have in their life to do things that they were never able to do before because they were drinking all the time. They feel much healthier. Physically, they feel better. They have more energy. They feel like just thinking-wise, they're much more alert and much more with things. So I think a lot of times people think that when they stop drinking, it's going to be a very painful experience. And many times it's not. It's a very positive experience. In fact, a lot of times we warn soldiers that there's going to be almost like a honeymoon phase to it, where everything's just going to be really good. And it's going to be that way for a while. There is a time when you're going to come back to the fact that life is challenging, life is difficult, and a lot of those challenges are still going to be hard to deal with even when you're not drinking. But initially, sometimes, like I said, it's almost like going through a honeymoon phase, that it's just a really positive time period. The soldier was a self-referral, had 2 previous incidents that the soldier had gotten in trouble. But both times the soldier came in for their evaluation with drug and alcohol and was not truthful about his alcohol use, which is not unusual. Soldiers often are reluctant to tell you the truth. They don't know if you can help them or not, and whether that's going to get them in trouble. But his alcohol use had become such a problem that in March timeframe he self-referred. Began working with him, meeting with him individually. We'd actually recommended a higher level of care, but for various reasons, COVID started up about that time. It was not possible for him to go to a higher level of care. Continued to follow through with him individually. It took about 2 or 3 weeks. We got him on medication for his alcohol use. He was able to stop drinking. As soon as he stopped drinking, things started to get better for him. Life started changing. He really enjoyed being sober. And that soldier, we continued on a weekly basis. There was a point where we reduced that down to once every couple weeks that we were meeting instead of weekly. And the soldier has now been discharged from the program. I continue to follow up with him in aftercare. Just check in with him every couple weeks to make sure that he's staying on track and doing okay. And he actually PCSed to another post and ran into a number of stressors once he left here. So it's really good that we continued the aftercare because I was able to help him with that and the transition to the new post. And we didn't actually have to get his new command involved because he had completed treatment, and with aftercare that wasn't necessary. So, and that soldier today is his last drink of alcohol was in March timeframe. Sometimes soldiers don't do so well in treatment, and there are times that they relapse and that things happen to them. But on the other hand, there are a good many soldiers that make good progress, good success, and their lives are changed as a result of it. I don't force soldiers to do what I want them to do. Really try to tie the treatment into what they want. And so I think that personal relationship is a big important part of it. I think also the treatment planning. A lot of times soldiers know that they have a problem. They don't know how to go about fixing it. And sometimes I think as counselors, we bring that part to it, that we can head them in a direction that will help them to resolve the problem and to get better. And I think a lot of times they just need some help with that, knowing where they need to go with things to get better. You know, sometimes soldiers want to go in a direction that, I think is concerning. A soldier that's got a serious alcohol problem and wants to learn how to manage their drinking instead of stop drinking. And I know that most of the time that does not work well, and that is not going to be successful for them. What I do is I talk to them about that, look, in this situation, the recommendation is that you stop drinking, to try to manage your drinking based on what you've been through and your past history. The chances of you being successful are not real good. It's very likely that you're going to fail at this. And a lot of times you talk that through with them, and they realize that they need to go further with it, and that they need to stop drinking rather than trying to manage it. But there are oftentimes not, that they get out of the program and they do try to manage their drinking, and sometimes they're coming back to us then that just did not work for them. And you feel bad for them, and it's unfortunate. Sometimes they're being chaptered out of the military, but you do the best you can to try to help them. And you don't help them when you tell them what to do and try to force them to do what they don't want to do. That just is not going to work for the soldier. I think it is viewed as a disease, and there was a long time early in my counseling when I didn't believe that, I didn't accept that. Now I've come to a place where I completely understand that, and I think it makes complete sense. I think with a lot of diseases, the first thing you look at is family history. Did you have any family history of this disease? Addiction is the same way. Family history is a primary factor in somebody developing an addiction. If you've inherited a predisposition to addiction, I think once you start drinking, or once you start drinking or using drugs, then you kind of set that whole process in motion. Now, there are things that you can do that make it more likely that you head down that route. Abusing alcohol or abusing drugs would be considered getting intoxicated. With alcohol, the more frequently you abuse alcohol, the more frequently you get intoxicated, the more likely it is you're going to go down this path and develop this addiction. Another thing that can play into that is the stress in your life. If there's a lot of stress in your life, we know that stress is also an important factor to developing an addiction. And so if you're under a lot of stress and you're drinking, chances are you're going to drink. Your drinking is going to continue to increase. It's going to continue to get out of control, and it's going to take you down that path of addiction. You know, when an individual develops an addiction, their self-esteem is really beaten down. They don't feel good about themselves. They feel it's their fault, that they are a failure, and it's all due to what they have done. And it's important for them to realize that there are some things going on here that they don't really have control over. Certainly, maybe at a younger age when they started drinking, maybe when they started drinking to intoxication, they had control over that. But that's not an unusual thing. In our culture, that's fairly normal. That's fairly typical. When they started drinking like that, they had no idea that it was going to develop into alcoholism, and that it was going to become the problem that eventually it did become. They can walk into any of the embedded behavioral health clinics, the behavioral health clinic here in the hospital. They can just walk in and self-refer. They can also call 239-DOCS, and I think it's selection number 8. That will get them to the behavioral health clinic, and they can just request an appointment to see a SUDCC provider, somebody for alcohol use or for drug use, either one. And they will schedule initial evaluation. For alcohol use, if they're a self-referral, we can provide treatment for those soldiers without their command being involved. And so it'd be confidential. We'd have no contact with command. There's no threat to their military career. And so that's an option that just became available here to us in the last year or so. It's a very difficult thing going through life with an alcohol problem or a drug problem. And a lot of times the individuals, the longer they go with those problems, it's considered to be a disease of loss. And the thinking is that they lose everything. They lose their job, they lose relationships, they lose their health. Legally, they get into trouble. Eventually, they lose everything. And it's a very painful disease to have to go through life with. And it is easily treatable. A lot of people don't realize that. You really can make changes. A lot of people believe, I'm stuck with this alcohol problem, I'm stuck with this drug problem, I'll have to go through the rest of my life with this. That is not true. People can make changes, and they can live the rest of their life very healthy and very happy.